Hello, my name is Jean O'Connell and I'm one of the doctors working in the weight management service in St Colmcille's Hospital. There are three physicians or medical doctors, myself, Donal O'Shea and the registrar Enos Elliman, and there are two surgeons, Helen Hennigan and Justin Gagan. I'd love to be confident that all consultations with doctors are as friendly and open as it appears in this picture. Unfortunately, I know that the opposite is probably the case. Many patients have shared with me a whole range of negative experiences they have had in the past with doctors and also with other healthcare professionals. We are actively trying to improve education and training for all healthcare professionals and students so that weight bias and stigma in healthcare settings are reduced. Weight bias is when a person has negative attitudes and views about people living with obesity. Weight stigma is the manifestation of weight bias through harmful social stereotypes that are associated with people living with obesity and that can become deeply rooted in society. Weight bias and stigma can lead to discrimination, which is unjust treatment of a person because of their weight, which can take place in schools or workplaces or relationships with other people. Unfortunately, it can also happen in healthcare settings. Examples would be a health professional using insensitive language or not listening to why you came to see them or blaming all your problems on your weight. One of the most harmful forms of bias and stigma is when it becomes internalized. This means holding negative views about yourself, and this can make it much harder for you to manage your weight and your health. Studies have shown that experience of stigma has many negative effects, understandably on your mental health, but also on your physical health, as it's associated with increases in blood pressure, cortisol levels, and inflammatory markers. Experiencing stigma is also associated with unhealthy eating patterns, increased calorie consumption, and an understandable reluctance to interact with healthcare professionals. Stigma often arises out of misunderstanding and lack of knowledge, so the team at St Colmcille's Hospital have an ongoing programme of education for health professionals. We explain to them that obesity is not a choice, but a complex chronic disease influenced by multiple genetic, biological, and environmental factors. The list on this slide includes many but not all of these factors, and I've highlighted genetic predisposition because it's such an important factor, and the contribution of your genes to your body weight can be up to 75%. This does not mean there's nothing you can do to modify your genetic risk, but it does explain why you may have to work harder than other people with different genetic makeup. The different factors on this slide can all contribute to weight gain. They can mean that losing weight is challenging and why it's so common to regain all the weight that you have lost. This is why we encourage health professionals and patients to focus on health gains rather than weight loss. And we are working towards creating healthcare environments that are safe and welcoming spaces for everyone for all of these reasons, but primarily because everyone deserves to be treated with respect and compassion. Obesity is a very complex condition, but the key messages I would like to emphasize are: obesity is not your fault. Obesity is a disease. Obesity is not yours to manage alone. Obesity is a worldwide health concern, and as with any disease, it is our job to help and support you. Obesity is caused by many factors. It is not just about food, and it is not cured by a miracle treatment, but it is treatable and manageable. You may have had unhelpful conversations in the past with doctors who told you that you have to lose 4 or 5 or 6 or more stone, but they may not have told you that with just 5 to 10% weight loss, you can see significant improvements in many important aspects of your health, such as reductions in diabetes, improvement in glucose levels, improvement in cholesterol and other parts of the lipid profile, reduction in blood pressure, improvement in sleep apnea, and lower risk of heart disease. So rather than focusing exclusively on a specific weight loss goal, We encourage you to focus on improving health and well-being, which is so much more important than the number on the weighing scales. At your first visit, the doctor will take a history of any current or past medical illnesses. They'll ask you for a list of your medications, do an examination that includes a check of blood pressure, and take some blood tests. It's really important to bring a list of your medications with you, or you might take a photo of your prescription with your phone and then you can show that to the doctor. Unfortunately, there are a very small number of medication options to help people manage their weight, especially when you compare obesity to other diseases such as diabetes and high blood pressure that have a whole range of different medications to try if one doesn't suit or isn't effective. This situation is slowly changing, and hopefully in future we will have more options to choose from. But for now, we have three main options. Orlistat is a tablet taken 3 times per day, which reduces fat absorption from the bowel. And this can be associated with some weight loss and also some side effects such as diarrhea. Liraglutide is a medication that is given as a once daily injection, self-administered, initially developed for the treatment of diabetes, and it makes you feel fuller for longer. It can help weight loss when used with diet and exercise changes. There is also a weekly version of this medication for people who have diabetes. Naltrexone bupropion, or the brand name is Mysimba. This can reduce hunger and help control cravings. Not everyone is suitable for this medication. There are a number of medical conditions that mean you would be unable to take it or that you would require additional monitoring. Unfortunately, there is currently no reimbursement for any weight management medications under the medical card or drug payment schemes, unless you also have diabetes. You can talk about the whole area of medications in more detail with the doctor when you see them at your first visit. After you've attended approximately 6 appointments, we may discuss the option of bariatric surgery. If you are interested and if the team agrees that this is a safe and potentially effective procedure for you. We no longer perform the gastric band surgery as there were many complications associated with that procedure. The main two surgeries are the gastric bypass and the sleeve gastrectomy. If surgery is something you're considering, we can discuss this in more detail with you, including the pros and cons of each type and which may be best suited for you. Thank you for listening, and we look forward to meeting you.